Come in.
Hey, I'm Kendall. I'm going to be your nurse today. How are you?
I'm doing good, thank you.
Good. I'm going to just go over here in the corner and wash my hands. Doing okay today, you said? All right. So the doctor sent me in. I'm going to take care of you today. Like I said, my name is Kendall. I'm just going to ask you some questions.
Okay, thank you.
All right. Let me get that thrown away and one more paper towel. I can put some gloves on. All right. What brings you in today?
I just have some abdominal pain, like really, it's like a 9 out of 10. I would describe it like really, really bad.
Okay. All right. Was it sharp or dull?
Maybe like a burning, cause it's like in my stomach, maybe some gastric pain.
Okay. All right. Let me verify your name and date of birth, please.
Okay. Betsy King, born October 23rd, 1975.
Okay, Miss King. Thanks for verifying that. You have any allergies today?
No, I'm not allergic to anything.
Okay. All right, and I'm just going to take a look at a few things here. Follow your lines. The IV line was a little kinky, so I'll straighten that out for you. And how does my IV site look?
As far as I know, it looks okay. I guess it looks all right.
All right.
Not too bad.
Just sanitize. I have to move that pole. And I'm just going to follow all the tubes back just to make sure for our safety that everything is hooked up correctly. All right. And I see you have the oxygen on. I'm just going to fix that around your ears.
Okay, thank you.
You're welcome. And that way when the doctor comes in, he don't think we made a mess of you today. All right. All right. Got it on there best I can. Get my hands cleaned up. All right. So you said your stomach just hurts a 9 out of 10, right?
Yes.
Okay. So what makes it better?
Well, what makes it worse is when I try to cough really hard and maybe reach over and try to get something, but nothing really makes it better because it's 9 out of 10 pain.
Okay. Now, have you had any pain medication today?
No pain medication.
Okay. Well, I'm gonna do a quick assessment on you. Okay.
Okay.
All right. So I'm just looking in your eyes here.
How long is this gonna take? I'm ready to leave the hospital.
Oh, it won't take long. Just take a couple of minutes. I'm actually going to do a focused assessment on you since you did say that your abdomen hurt. If you'll just follow this pen, I'll put the light on the side and I'll just bring it around.
Okay.
All right, and the pupils did straight. And then if you'll look here, okay. And you did follow me as I came in the room, so there is accommodation there. So the patient has Perla. All right, I'll put that away. And I'm looking at the IV site. It looks clean and intact. There's no kinks in the line. I followed those back. I straightened out that oxygen line on. Let me just tighten that up on your head. There's no obvious things going on here. I'm just doing your assessment, okay? All right, and then I'm going to pull your shirt down in just a second. But first, I want to check out a couple of other things. I'm going to press on your fingertips and get that capillary fill.
Yes.
Normal. Capillary refill.
Yes.
Normal. All right, and let me check your feet. Capillary refill. Normal. All right. So I did look at your skin as I did that. What I'm going to do now is I'm actually going to listen to your lung sounds. So what I'm going to do is I'm going to take these gloves off. And I'm just going to run and get my stethoscope. I left it out in the med room, so I'm going to go get that stethoscope and I'll be right back.
Okay, thank you.
You're welcome. All right, and it's just going to be a few moments. I think someone just picked up mine. So it'll be a few moments, just give them a second, okay? So while we worry about that, wait on that, I'm just gonna go ahead and get some more information that I may need from you.
Okay.
All right, so tell me a little bit about yourself. What do you do for work?
I just suddenly retired. I used to be an accountant at a bank.
Okay, all right. So I'm just going to check some vital signs here for you. Gonna check your blood pressure first. Let me get some more gloves on. I can get those vital signs out of the way.
Blood pressure is 104/60.
Okay. And then, gonna get there. I'm looking here at your respirations while I'm getting these gloves on.
His respiration's 28.
And then let me get a temperature on you.
101.2.
All right. And your heart rate, what's that like?
My heart rate is 108.
Okay. And then I'm gonna check the O2.
89%.
Okay, and we're at 89%. All right, that heart rate is just a little fast for us. And the oxygen level is just a little lower than what we like it to be.
It's just because I'm anxious, and the other nurse from the previous shift said I'm agitated also.
Okay.
I seem agitated.
Okay, well, let me bring the bed up for us. I want to be more comfortable when I care for you, okay? So I looked at your skin, I looked at your eyes and your lymph nodes and your neck and your shoulders. I'm obviously seeing in your mouth right now, like you said, you're a little agitated, but I do see that there's no lesions or anything like that. It says that you, let's see, checking the order. It looks like the doctor has you on, wants you on 2 liters of oxygen. Let me just make sure that's back here like that. All right, just checking the oxygen, and my ball is at the 2 on my oxygen level. It is attached and hooked up to a nasal cannula. All right, and I'm looking at my telemetry monitor. What is my patient's rhythm of her heart?
Heart rate is irregular.
Okay. Is it fast or slow?
It's just irregular.
Okay, all right. All right, so it looks like we won't be able to get your CT scan that the doctor ordered until in the morning. The CT scan machine is broke, so won't be able to do that. However, we did get that ultrasound completed. When was your last bowel movement?
I think last night.
Okay, and was it normal?
Maybe was it a little fatty? Maybe from my gastric. Maybe from my gastric.
Okay, and when was the last time you urinated?
I think last night also.
Okay. And what color was it? Did it stink or have an odor to it?
The urine, I think it was just normal, within normal limits.
Okay. All right, so the goal here today is for us to keep your oxygen up. So I'm going to sit the bed up a little bit. All right, perfect. All right, so you said your pain was a 9 out of 10. Before I start anything, would you like me to give you something for pain? I have some Rocephin that the doctor prescribed for you. Some Demerol, I'm sorry, that the doctor prescribed for you every 3 hours for pain. So right now you have the lactated ringers hanging right here, but the doctor said we can also give you something for pain. Would you like that medication?
Or do you have something for my respiratory?
Yeah, well, I got the oxygen hooked up on a nasal cannula at 3 liters oxygen. Are you feeling better yet?
I think maybe something in my, lower.
Lower, all right, let me lay it back down. Just a little bit. I'm sorry about that.
Okay, thank you.
You're welcome.
And it's clear.
All right, I'm gonna lift your shirt up. Is that okay?
Yes, otherwise clear in all lobes, respiratory.
Okay. All right, so I'm gonna look here, and it looks like you have a big dressing there.
Was it abdomen, generalized tenderness, and I feel very.
Is it okay to touch?
Maybe lightly, but I just feel very nauseous and having dry heaves.
Okay, so what I'll do for that, sir, if you like, I have some nausea medication that the doctor did prescribe on the Cetrin or Zofran. We're able to give that to you every 4 hours as needed for nausea and vomiting. So to prevent that, I also brought a cup in here for you, or to help with that. Oh. I brought this cup. We can keep this in your hand, and I won't put it in the IV hand. I'll put it in this one.
Is that to drink water?
Well, no, this is just to catch, if you feel like you're gonna throw up, you know, and I may be stepping away or here, you can just kind of spit that in the cup.
Okay, because I'm very constipated and I've been having poor appetite for the past 3 months.
Okay, so you may not have a lot of fluid is what you're saying.
No.
Right. So what I'm gonna do, I'm gonna go ahead and give you this Zofran that the doctor ordered, okay? I'm gonna scrub the hub for 30 seconds.
Yes.
Okay. And I'm gonna sit that there. My medication is prepared. And also, I am going to hang this Zofran here for you. All right, scrub this hub. All right, now while I'm scrubbing that hub for 30 seconds, if you can verify again your name and date of birth.
Betsy King, October 23rd, 1975.
All right, Ms. King, any allergies?
No, I'm not allergic to anything.
All right, and I have checked it against the medication record. And I have scrubbed the hub for 30 seconds. All right, so that scrub, this is here. All right, just getting that machine on for us. I'm gonna go ahead and open up my normal saline because I'll need to prime the line first. And I'm giving you Zofran. It usually doesn't burn or anything like that. It's just gonna feel a difference in your mouth when that comes through there. All right. So I'm just gonna stop your first transfusion and then I'm gonna start your piggyback here, transfusion. And the doctor wants you to get 50 milligrams every 3 hours.
Okay, thank you.
Let's grab that hub. There we go. I can take this off. I'm gonna waste 20. And then I'm gonna put this in here. And I'm gonna flush it to you, okay? And that's just to make sure we have a patent line here, that it'll get to you, whatever comes here. Flushes in. I'm gonna remove that. All right, and then your piggyback is gonna be set at, let's see. Let's see, that's about 200 milliliters in the bag. Supposed to be, so I'm gonna put it a little under that actually. And that way it'll give me time to come back and stop it for you. So I'm gonna put it on 190. It's gonna beep when it comes time for me to come here. And then, so I have it there. I'm gonna continue it in a second. What I'm going to do now is I'm going to get this connected for you. All right, so this is here. Yeah, I don't think I got the right one because this one is going in here. So I'm going to remove this one. I'll sit that over there. And this is still sterile. And then I'm going to use it to put this bag on. Because this is the piggyback that the doctor ordered for you to have.
Okay, thank you.
All right, now this is going to be for pain. It's Recephin. I'm sorry, not Recephin. It's Demerol. Demerol is going to be for your pain. That is full there. And then in a few seconds, you'll feel a little different here, okay?
Okay, hope so.
All right. All right, so now I have line B with my piggyback pumping over my lactated ribs. Okay. All right. Have you had any facial surgeries or anything like that?
No.
Had you had any trauma to your face?
No.
And have you had any oral surgeries? Have you had any problems with your stomach?
No, no gastric surgeries.
Okay, okay. So no bypasses, no lap bands or anything like that. You had anything with throat surgery?
No, no esophageal varices.
Okay, all right. So as long as you haven't had those things, I can go ahead and proceed. You can't have any gastric bypass, no esophageal varices, and you cannot have had any facial surgeries, okay?
Yes, facial traumas, yes.
Okay. No trauma in the face, thank you. All right. All right, so we did an ultrasound. It does show like some lab involvement for your pancreas. So I'm gonna give the doctor a call and see what he wants us to do. We did do that clean catch urine sample and it was dark. All right, so just give me a second. I'm gonna call the doctor and see what the doctor wants us to do next.
No, okay, thank you.
You're welcome. I'm sorry, ma'am. I have to let your bed down to the lowest position for safety because I need to listen to your abdomen, okay? And I still have to listen to those lung sounds.
Yes. Oh, hello.
Hey, it's me. I'm Kendall, your nurse. I'm back in. Had to go grab that stethoscope so we can move forward with things, okay?
Yes, my name is Betsy King.
All right. What's that date of birth on you, Miss King?
October 23rd, 1975.
Okay, so your name's Betsy King, and you were born then. And do you have any allergies?
No, I'm not allergic to anything.
Okay, I'm gonna let the bed up for my safety and yours as well. Put my gloves on and I'm gonna look, listen, and feel your abdomen lightly, as you said.
Yes, ma'am. Thank you.
Alright, so I'm gonna put that on and keep it closed. Okay, so we need to flush. Alright, I'm gonna look. Alright. Am I able to remove this?
Yes.
And that way I can get a good look at your abdomen.
Why even?
Alright, so
Okay.
I see here, I'm looking, and it looks like it's a little poked out. Do you feel like that is a little poked out?
Yes, some tenderness. Some
Okay.
tenderness.
Alright, I looked at your 4 quadrants.
Yes, hypoactive bowel sounds.
Okay. In all 4?
Yes, and I'm feeling nauseous, and I think I'm having dry heaves.
Okay, let me
Yeah,
listen.
and I've been having for the past 3 months, I've been having a poor appetite. I've been eating candy and just nothing but soda, and I'm feeling a little constipated.
You've been drinking a lot of soda though, huh?
Yes.
Okay. Alright. Alright, so I have the documentation I need for that. Alright, now I'm just gonna clean it off. And I'm gonna listen to your lung sounds, okay, sweetheart?
Yes. Respiratory absent in the lower lobes. Otherwise clear in all other lobes.
Okay. Set her up.
My stomach
right.
hurts.
All right, thanks for your patience, sweetheart. I went ahead and did that. We went ahead and gave you a Zofran. Your nausea should be subsiding. And I'm going to call the doctor because that's all we have left to do. Let us see what he wants us to do. And have you had any tremors?
No.
Okay, so I'll let the doctor know you hadn't had any. You are to have nothing by now, because we're still trying to figure out what's going on here. Your call light is here. Just want to give the doctor a call a second, okay? Ring, 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 ring.
Yes. Hello.
Hey, this is Nurse Kendall. I'm calling from the Med Surg Unit. I'm calling about Miss Betsy King, room 577. The problem I'm calling about is she's possibly having acute pancreatitis. I have done an assessment on the patient. She's a previous smoker, divorced, and she's a retail worker. She smokes about a pack and a half of cigarettes a day. She's complaining of some upper epigastric pain. We have ordered a CT. We weren't able to get the CT completed because the machine was broken today. Hopefully we'll be able to solve that in the morning. She did a urinalysis. It came back with dark urine on a clean catch. And her labs do indicate pancreatic involvement. Right now I have respirations at 28. Her BP is 120/50. Her heart rate is 108. And her oxygen level is 89%. I did go ahead and add 3 liters of oxygen as ordered. And you want it titrated until she gets to 93%. What's my patient's new oxygen level after the oxygen?
95.
Okay, the patient is currently at 95% O2. Heart rate is still irregular. The last BM was fatty a little bit, and it was on yesterday, and as well as a urinalysis on today that we had that was dark but normal. She has hypoactive bowel sounds, and no trauma, no gastric bypass, no facial trauma or surgeries, and no epigastric bursies.
Esophageal, yes.
Esophageal bursies. So what do you want me to do, Doc?
And you said and it was just dark urine?
Yeah, it was dark urine. She did do a clean catch, but it was still pretty dark.
Do you recommend anything?
I think we should just continue her on the lactated ringers. I did give her some for nausea, but what I think that we should probably do is to go ahead and just keep the patient sitting up, evaluate her pain. And it looks like she may just need an NG tube inserted just in case. So we will do the CT scan in the morning. At the worst case scenario, if something's wrong, we've already prepared for that. And we haven't made her situation, exaggerated her situation and made it worse.
Okay, I think you should do that because I don't recommend anything on my part.
Okay.
And then plus it's just dark concentrated urine, so it's nothing. Just recommend some patient teaching of more fluids maybe.
Okay.
Fix the poor diet, and I think that'd be it.
Perfect. Thank you so much, Doc. Talk to you later.
Thank you, bye.
Mm-hmm. All right, so we did go ahead and give you the pain medication, and I am also gonna hang this nausea medication for you, which it should be lower. This is lower, and I should hang that nausea medication for you. And then I also will spike this bag because the nausea medication is needing to be given to the patient. So I would open this and spike this, and then that will go to the patient. And I would ask my patient, how's your nausea now?
It feels good now.
Okay, perfect. On a scale of 1 to 10, at 1 being the least pain and 10 being, or 0 being no pain and 10 being the worst pain, what is your pain level at the point after the pain medication?
It says it's still 9 out of 10.
Okay, still a 9 out of 10. That's quite all right. So we can give you that medication. Like I said, the Demerol, which is the pain medication, we can give it to you every 3 hours. It'll be on an IV piggyback that the doctor ordered. Looks like you had your insulin today. All right, cool. So I'm gonna just go ahead and do what the doctor said. And give me just a moment. Let me get my stuff together. This cup, again, I have a different cup for you. This is going to be for this procedure. Have you ever had a NG tube inserted before?
No, does it hurt?
It's a little uncomfortable. A lot of patients would say it's uncomfortable. Of course, it's going down your nose. It's going to be an actual tube going down there. So, you know, it's definitely not going to be comfortable. But it's going to be quick. So what's going to happen, if you'll look at this model here, I am going to measure from here to the top of your ear in your nose, and that's how, yeah, from the tip of your nose to the pinna, which is the top of your ear, to the xiphoid process, and that's going to be my measurement, and that's how far I'm going to go in. So then at that point, I'm going to have you stay chin down. I'm going to hand you this cup of water, and what you're going to do is you're going to be chin down, and once I get some resistance, I'm going to ask you to lift your head and take a couple of sips of water for me. When you take a couple of sips of water, it's going to allow this to open up, and then I'll be able to proceed down into your stomach, okay? So that we can make sure that anything going on with your stomach can be bypassed, and we can still get you the nutrition that you need. I did hear you say that you weren't eating, regularly for a couple of months or so, so we can get you back right.
Okay.
It's just going to take a little time, okay?
Okay, thank you.
All right, we're all in this together. All right, give me just a moment. I am sorry. I'm going to go and get the nasal gaseous tube. Since the doctor does want to proceed with that, we can't have items that we're not going to use in the room, or we can't use them for any other patient. So I don't want to keep bringing supplies in here and then the doctor decided to not do it. So
That makes sense.
Apologize about going in and out, but that's why we do it. That way we can keep a clean environment for all of the equipment.
Yes, of course. Thank you.
You're welcome. So I think that's all I need. I have the cup, so I'll give this to you with the straw, and then you drink that while I'm going. I just need the tube and my lube, and I'll be right back.
Okay, thank you.
You're welcome. Thanks for your patience. Oh, let me let your bed down. I'm sorry, ma'am. I want to keep you at the safest position possible, okay?
It's okay.
Yeah, girl. I don't want you right gliding out this bed.
All right.
All right, be right back.
Oh, hello.
Hey, it's me, your nurse again, for the third time. All right, let me get my stuff set here. I'm going to go over here and get my hands all cleaned up.
Yes, my name is Betsy King.
All right, and if you'll verify that name again and date of birth for me, please.
Betsy King, October 23rd, 1975.
All right, Miss King. All right, we're going to get this nasal gastric tube. It's going to go through your nose as we described. Did you have any questions before I started the procedure for you?
No.